Hello, welcome to Gen X Medic. The statements I make are not going to be representative of my employer or any other group that I belong to. Um, these are my opinions based off of the realities I've seen and discussions I've had with other online providers who've had these discussions, and just the reality of human nature as I've seen it in 23 years of EMS. We're going to be talking about COVID-19 and its effect on the medical system. It's an indirect effect, not the direct effects of it actually causing people to be sick, but the fear of getting it and the fear that has created a culture where it's harder to get people into primary care physicians, specialists, and urgent cares, as well as getting people to go to the ER. A lot of the people who aren't going are people who are having heart attacks, they're having mental issues, they're having issues that involve congestive heart failure, chronic obstructive pulmonary disease, asthma, and long-term ailments that these people would have sought help for. Right after the pandemic started, we saw a massive decrease in ambulance transports and use of the medical system because people were honestly afraid to go to the hospital. So we got a lot more of against medical advice, refusals of care. We've gotten a lot more. We just didn't see people going to the hospital, despite the fact we really thought a lot of them needed to go. And then things picked up because patients got worse. Personally, I can say that I've found a lot more people who were in cardiac or who actually were dead. They weren't in cardiac arrest; they were dead. They were too far gone to possibly come back. We've also found patients that they get so sick that they require greater interventions, riskier interventions, both from the pre-hospital and in the hospital environment. This creates greater stress, requires higher level bed for that patient, and in the process, it's causing it so people have to go further away for those beds. It's not just COVID that's doing this. This is what the media has not talked about, and it's very important to be covered. We've created a culture where people are so afraid that it's harming people. And it's not harming some abstract person. It's harming people that you know. It'll be your grandmother who's had a long-term illness that she's managed well. Now she won't go to the hospital. Now maybe next year your grandma's not there for her birthday, which she would have been. Your sister, her brother who have asthma, they put it off. Now by the time we get there, it's too late to correct it, and we're doing all kinds of aggressive treatment for this patient, which may or may not work because you can get too far. You also wind up having situations where people wait way too long, obviously, and they're dead. This is a situation that's really affecting the medical community now. Not just locally. This is nationwide. I know people who were in New York during the height of the pandemic who were talking about this. They just found a lot of people that just stayed in their home and died. We've got to get people going back to where they need to go. We need them to go sooner. You need to go see your physician. You need to contact your physician. You need to go to urgent care. You need to go to the ER if you need to go. You're not a burden when you're doing this. This is what we're here for. This may be me shouting into the ether, but I'm really tired of people dying for no reason. Stuff that's preventable. And the media needs to report the truth on this. They report one part because, let's be honest, it gets ratings. This is just as important. And this affects people's lives. It doesn't just affect the patient. It affects their family. It affects the people that matter. And I can honestly say my family's been affected by something that may have been caused by this. This is Gen X Medic. Please, if you think this is important, like, share, subscribe, comment, but most importantly, share. Get this out there. It might save someone's life. It might make someone realize, hey, I need help. It may make someone say, hey, you need help, and get their family member where they need to go soon. It's rough. It's rough seeing these things because you know how it affects people, and if you get any empathy, you know that these people are hurting no matter what. Have a good day and Godspeed.